Good day everyone, my name is Trisha Angie Martinico from BSN 2D, and today I will be performing administering oral medications to a patient. First is to perform hand hygiene. Wash our hands with soap and water or sanitize our hands. It is to prevent the spreading of microorganisms. And the next, as a nurse on duty, we have to check the patient's chart first and compare it to your medication and compare the medication that is taken by the patient. So, in this top corner, this is the patient's name and this is the doctor's or the physician's name. So, we have to check the doctor's order and compare with the medication, the administration record and compare it to the medication ticket. So, this is the medication record of the patient. This is the medication, which is the ascorbic acid, 500 mg. And this is the doctor's order for stronger immunity. Next is to prepare the medication. Adhering to the 5 rights of medication administering organization that facilitates error-free administration and saves time. Then, identify the client by reading identification bracelet and by addressing the client by its name. So, hi ma'am. Hello. So, Martes Martinico, 45. Okay. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's order, and then explain the procedure and purpose of the drug and also educate the patient about the medication. So, hi Ma'am Martes. So, this is the drug that boosts your immune system. This is the ascorbic acid, which is the doctor's been prescribing you, and it is also good for the healing of your wounds. Then the next is to prepare the equipment that is needed for us to prevent the errors and to save time and energy. Then verify any allergens listed in the medication record or electronic medication record. Evaluate the therapeutic effect of the medication. Obtain pre-assessment data. Data collection needs to be checked. Then, separate the drugs that might be held on pre-assessment data, for documentations will be accurate. Assess the client in semi-fowler or sitting position, for the comfort of the patient while taking the medication. Don gloves if there is possibly of exposure to oral secretions, for the protection and to avoid contamination. We could also use our bare hands in administering the medication, but we should make sure that our hands or our fingers will not touch the medication itself. Open the unit package dosage and place in the drug in one of the client's hand and pour the medication cup and give the cup to the clients. Provide assistance if needed. Let the patient take the medication and observe of the assist if the patient cannot perform by itself. Instruct the client to place the tablets or capsules into the mouth and to follow with enough liquid to ensure. To let the patient know which route will the patient take the medication. Next is to administer liquid medications after pills, instructing client to drink all the solution, then provide assistance if needed. Presuming that this is the liquid medication, and we're going to let the patient drink it. For the capsule or the tablet to become soluble fast enough and to swallow. So, remain the client until all the medications are taken. Check the mouth if there is any question of whether the drug has been swallowed. Can you please open your mouth, ma'am? Okay, the drug has been swallowed. To make sure that the patient took all the medications that are ordered. Reposition the client and place call light within the reach for easy access and comfort. Lift side rails whenever the patient is moving to the sides of the bed. Discard or restore equipment properly. If client refuses drug or drug has not been given for any reason, do not leave the drug at the bedside. Remove drug from the room and restore in medication drawer or cabinet only if unopened unit dose package. If unit dose package has been opened, discard in sink or flush down toilet with witness present if necessary. The rationale for this is only place the required equipment and medications are intended. Then, the next is to remove the gloves and perform hand hygiene. Throw away contaminated gloves to avoid the spread of infections. Document administration in medication administration record for the accurate dosage needed. Assess client 30 to 60 minutes after administration and document client's response to medication. If these are any reactions against the drugs. So the attitude of the student nurse, she or she should accept constructive suggestions and criticisms, opens to all suggestions and criticisms from others, assumes responsibility of his or her actions for the improvement and betterment of oneself. And that would be all. Thank you.